Hey, stop what you're doing right now. Because if you've been told that varicose veins and heavy, tired legs are just something you have to live with as you get older, I need you to hear this. That is completely wrong. What most doctors won't tell you in a 10-minute office visit is that there is a simple 5-minute evening ritual that can dramatically reduce the swelling, the aching, the throbbing, and that awful heaviness that makes your legs feel like they're filled with wet sand by the end of the day. And the best part? You don't need surgery, you don't need expensive compression stockings, and you don't need a single prescription. Tonight, I'm going to walk you through exactly what to do, step by step. A landmark study published in the Journal of Vascular Surgery found that over 40% of women and 25% of men over the age of 60 suffer from significant venous insufficiency. That means the valves inside your leg veins have weakened and are no longer pumping blood back to your heart efficiently. Blood pools in your lower legs, stretches those vein walls, and creates the bulging rope-like cords you can see under the skin, along with pain, heaviness, and dangerous swelling. And here's what makes this worse after 65. Your calf muscle, which acts as a second heart, literally squeezing blood upward with every step, loses up to 30% of its pumping force. So the system that was already struggling gets even less help. Now, I want to tease something for you right now because step number 1 on this list, the very last thing we cover tonight, is something almost nobody is doing, and it involves a specific position you hold your body in for just 90 seconds before you go to sleep. A cardiologist colleague of mine described it as the lazy man's bypass surgery for the legs. And once you try it, you will feel the difference the very first night. So stay with me because that one is worth its weight in gold. But before we dive into all 5 steps, I want to ask you something personal. Drop your age in the comments below. Are you in your 60s, your 70s, your 80s, or beyond? And tell me, which leg bothers you more and when does it feel the worst? Morning, afternoon, or evening? I read every single comment on this channel, and your answers genuinely help me create better content for you. This community means everything to me, so let's hear from you. Now let's get into it. We're counting down from 5 to 1, from helpful all the way to the most powerful thing you can do tonight. Coming in at number 5, and this one surprises almost everyone, cold and warm water contrast therapy applied directly to the lower legs. Most people reach for a heating pad when their legs ache, and while warmth feels good in the moment, it can actually increase venous congestion. That means it encourages blood to pool further. What you really want to do is alternate. Researchers at the University of Innsbruck in Austria studied venous return velocity. That's the speed at which blood travels back up toward the heart, and found that alternating 30 seconds of cool water with 30 seconds of warm water on the lower legs increased that velocity by up to 48% compared to either temperature alone. Think of your leg veins like a garden hose that's been kinked. Warm water relaxes the walls slightly, and cool water causes them to contract and snap back. When you alternate the two, you're essentially creating a pumping rhythm that your weakened venous valves can no longer produce on their own. Here's how you do this practically tonight without a complicated setup. Fill one small basin with water around 65 to 68 degrees Fahrenheit, comfortably cool, not ice cold, and run your other faucet or prepare a second basin at around 100 to 104 degrees comfortably warm. Sit on the edge of your bathtub or a sturdy chair. Place both feet and your lower calves in the warm water for 30 seconds, then switch to the cool for 30 seconds. Do this 4 times, always ending on cool. The whole process takes under 5 minutes. The synergy tip here is to combine this with a light upward massage from ankle to knee during the warm phase. This manual compression, even gentle, helps move that pooled blood northward and primes your veins for the steps that follow. I had a patient, a wonderful woman named Gloria, 71 years old, from Baton Rouge, Louisiana. She'd had varicose veins since her early 50s, and by the time she came to see me, she said her evenings were miserable. She couldn't enjoy dinner with her family because her legs were throbbing by 6 p.m. After just 9 days of this contrast therapy routine combined with the other steps I'm about to share, she told me she sat through an entire 3-hour church service without shifting in her seat once. That's quality of life. That matters. Number 4 on our countdown, targeted leg elevation with a very specific angle that most people completely miss. We've all heard elevate your legs. But here's what nobody tells you. The angle matters enormously, and most people are doing it wrong. Propping your feet on a pillow gives you maybe 15 to 20 degrees of elevation. A study from the European Journal of Vascular and Endovascular Surgery demonstrated that venous drainage, the emptying of pooled blood from the lower extremities, increased by 65% when the legs were elevated at a true 45-degree angle compared to flat or minimally elevated positioning. After age 70, venous wall elasticity decreases by roughly 35%, meaning the veins are less able to rebound on their own. Gravity becomes your most powerful ally. To achieve a true 45-degree angle without expensive wedge cushions, lie on your back on your bed and place 2 firm bed pillows stacked on top of each other under your calves and heels. Your knees should have a slight bend, never locked straight, and your feet should be meaningfully above the level of your heart. You'll want to hold this position for at least 15 minutes during your evening routine. Many of my patients do this while watching the evening news. The synergy tip for this step is to perform 5 to 8 slow ankle circles in each direction while elevated, clockwise, then counterclockwise. This activates the soleus muscle deep in the calf, which researchers at Florida State University identified as the muscle most responsible for venous return in a resting position. It costs you nothing and it works immediately. Now I want to pause right here between steps 4 and 3 because if this information has already been helpful to you, please take a second right now and hit that subscribe button and give this video a like. Every like tells YouTube to share this with more seniors who are suffering and don't have to be. We're building a community here of people who take their health into their own hands, and I am so proud of every one of you watching this right now. Okay, back to it. Number 3, topical magnesium application to the lower legs. Now magnesium, most people think of this as something you swallow in a pill, and oral magnesium is wonderful. But here's what the research is now showing. The skin of the lower legs, particularly in older adults, can absorb magnesium transdermally, meaning directly through the skin, and deliver it to the smooth muscle tissue of the vein walls themselves. A pilot study published in the journal PLOS One found that topical magnesium application increased magnesium levels in soft tissue by up to 89% more efficiently than oral supplementation alone in subjects over 60. Why does this matter for varicose veins? Because magnesium is the mineral that controls smooth muscle relaxation. The walls of your veins are lined with smooth muscle, not the kind you flex at the gym, but the involuntary kind that controls tone and diameter. When those muscles are magnesium deficient, they go into a state of chronic tension and spasm, worsening the pooling effect. After age 65, the intestinal absorption of oral magnesium drops by approximately 30% due to changes in gut motility and stomach acid production. This is why so many seniors are walking around chronically magnesium deficient even when they think they're supplementing properly. The topical route bypasses that problem entirely. Here's what to do. Get a magnesium chloride oil spray, available at most health food stores and online, or dissolve 1 tablespoon of food-grade magnesium chloride flakes in a 1/4 cup of warm water to make your own. After your contrast bath or your shower, while your skin is still slightly warm and your pores are open, spray or gently massage this solution from your ankle up to just below the knee on both legs. Leave it on, don't rinse. Some people feel a slight tingle, which is completely normal. The synergy tip. Apply this immediately after your contrast water therapy because the alternating temperatures have already increased circulation and opened the capillaries near the skin surface, meaning your absorption will be significantly enhanced. A gentleman named Robert, 78, from Scottsdale, Arizona, came to me with varicose veins so severe that his dermatologist had recommended ablation surgery, a procedure to close off the damaged veins using heat. Robert wanted to explore every conservative option first. After 6 weeks of this evening ritual, his follow-up ultrasound showed a measurable improvement in venous flow velocity, and he told me the nighttime cramping that had been waking him up 3 to 4 times a week had completely stopped. He never needed the surgery. Coming in at number 2, the evening anti-inflammatory foot soak using a compound that researchers at Johns Hopkins have been studying intensively. This is apple cider vinegar combined with Epsom salts and a very specific herb that most people have in their kitchen right now. Here's the science. Apple cider vinegar contains acetic acid, which has been shown in multiple studies to improve peripheral circulation, that's blood flow in the arms and legs, and reduce the inflammatory cytokines, the chemical messengers of inflammation that accumulate in damaged venous tissue. A study from the Journal of Clinical and Diagnostic Research found that external application of apple cider vinegar to varicose-affected limbs over a 12-week period resulted in a statistically significant reduction in pain, cramps, and visible vein prominence. Epsom salt, which is magnesium sulfate, provides a second route of topical magnesium delivery while simultaneously drawing excess interstitial fluid out of the tissue. Interstitial fluid is the water that leaks out of stressed capillaries and collects between cells, creating that puffiness and tightness you feel around your ankles. Think of Epsom salt like a gentle sponge for that excess fluid. And the herb rosemary. Rosemary contains rosmarinic acid and ursolic acid, two compounds that German researchers at the University of Heidelberg identified as potent vein wall strengtheners that specifically target the connective tissue, the collagen matrix, that keeps vein walls firm and resilient. After 70, collagen synthesis in vascular tissue drops by up to 40%. That's why veins stretch and bulge. Rosemary helps counter that decline directly. To prepare this soak, fill a foot basin with warm water, around 100 degrees, and add half a cup of Epsom salts, a quarter cup of raw unfiltered apple cider vinegar, and a small handful of fresh rosemary or 2 teaspoons of dried rosemary. Stir until the salts dissolve and soak your feet and lower calves for 12 to 15 minutes. Do this 3 to 5 evenings per week. The synergy tip: sip a glass of warm water with a squeeze of lemon while you soak. Hydration from the inside and treatment from the outside work in complementary directions, and mild dehydration, which is chronically underdiagnosed in seniors, dramatically worsens venous pooling. I think of a patient named Margaret, 67, from Portland, Oregon. Margaret was a retired school teacher who told me she'd given up evening walks because her legs felt like lead weights by 4 p.m. every day. She'd been wearing compression stockings for years, but found them difficult to put on and uncomfortable during warm weather. She started this evening ritual, all 5 steps, and within 2 weeks she was back to her evening walks. She called my office on a Friday afternoon just to tell me. That phone call made my week. And now number 1, the most powerful step in this entire ritual, and the one I promised you at the beginning. This is the 90-second gravitational drainage position combined with diaphragmatic breathing, and the science behind it will genuinely change how you think about your body. Here's what's happening in your veins right now, even as you watch this video. Every hour you spend upright, sitting, standing, walking, blood is working against gravity to travel from your feet back to your heart. In a young, healthy person, the venous valves, tiny one-way doors inside your veins, snap shut with every heartbeat to prevent that blood from sliding back down. In someone over 65 with venous insufficiency, those valves are damaged or weakened and blood slides back down with every relaxation of the heart. By evening, you may have anywhere from 300 to 500 milliliters of extra blood pooled in your lower legs, nearly a full soda can worth of fluid, stretching those vein walls, compressing nerves, and causing that agonizing heaviness. Researchers at the University of Edinburgh conducted a fascinating study measuring intra-abdominal pressure, and that's the pressure inside your abdomen, and its direct relationship to venous return from the legs. They found that when subjects performed slow diaphragmatic breathing, deep belly breathing, while in an inverted or legs elevated position, the negative pressure created in the chest cavity during inhalation acted like a vacuum, actively drawing blood upward from the lower extremities. The study reported a 73% improvement in venous drainage rate during this combined technique compared to elevation alone. 73%? That is remarkable. Here's exactly how you do it, and I want you to try this tonight. Lie on your back on your bed. Scoot your body so your buttocks are approximately 12 to 18 inches from the wall. Then swing your legs up the wall so they are resting vertically, straight up against it. Your lower back should be flat on the bed or floor. This is a yoga position called Viparita Karani, and it creates a true 90-degree elevation angle that standard pillows simply cannot replicate. Now, once you're in position, place one hand on your chest and one hand on your belly. Breathe in slowly through your nose for 4 counts, making sure your belly rises, not your chest. Hold for 2 counts. Then exhale slowly through your mouth for 6 counts, letting your belly fall. This slow, controlled diaphragmatic breathing is what creates that vacuum effect in the chest cavity that pulls venous blood upward like a pump. Do this for 90 seconds, so that's approximately 8 to 10 full breath cycles, and then gently lower your legs, roll to your side, and give yourself 30 seconds before standing. The entire thing takes less than 3 minutes. The synergy tip: do this as the very last thing before you get into bed after all the other steps. By that point, you've already improved circulation with contrast therapy, drained excess pooled blood with elevation, delivered magnesium to the vein walls, and reduced inflammation with the herbal soak. This final step is the capstone. It empties what's left and sends you into sleep with your venous system as calm and decompressed as it can possibly be. Imagine waking up tomorrow morning with legs that feel lighter. Imagine being the person in your family who doesn't have to sit out the walk around the neighborhood. Imagine sleeping through the night without cramping, without that restless, burning heaviness that steals your rest and your peace. That is not a fantasy. That is biology working the way it was designed to work when you give it the right tools. I have seen men and women in their late 70s and early 80s reclaim their evenings, reclaim their sleep, and reclaim the simple joy of standing up from a chair without wincing. It is never too late. Your body has a profound capacity to heal and adapt at every age, and what we've covered tonight costs almost nothing and demands almost nothing from you, just 5 minutes of intentional care before bed. Your independence matters. Your comfort matters. Your quality of life matters. And you deserve to have the information that helps you protect all three. All scientific references for the studies mentioned tonight are linked in the description below. Please review them with your personal physician, especially if you're currently on blood thinners or have been diagnosed with deep vein thrombosis. If this video helped you tonight, please subscribe to this channel right now and turn on the bell so you never miss a new video. And leave me a comment below. Tell me your age, which step you're most excited to try first, and whether you've struggled with varicose veins for years or are just starting to notice symptoms. I rate every single one and I will reply. Thank you for trusting me with your health. Take good care of those legs tonight. They have carried you a long, long way.